Hello, I'm Dr. Sagar Lonial from the Winship Cancer Institute of Emory University in Atlanta, Georgia. And I want to talk just for a few moments about some of the emerging data sets, things that have already been reported recently, as well as things that might be on the horizon that might change how we begin to manage patients in the relapsed and refractory myeloma setting. We've been very excited in the last 6 to 12 months about emerging data in the context of early relapsed myeloma, with data from CARTITUDE-4, for instance, demonstrating significant benefit for cilta-cel, not only for standard risk patients, but even for patients with high risk myeloma, demonstrating superiority over best available therapy that includes daratumumab based salvage therapies like DPD or DKD. We've also seen data very recently from Majestic 3 looking at teclistamab in combination with daratumumab compared with best supportive available therapy, similar regimens to what you saw in Cartitude 4, also demonstrating really long remissions, and that many of those patients not only are in complete remission, but they're MRD negative. And so in the early relapse setting, I think the questions of bispecific versus CAR T cell are continuing to emerge. And I think a lot of those decisions are patient based. Many patients like the idea of a CAR because afterwards after they're done, there's no ongoing therapy, whereas many patients may prefer a bispecific because you don't necessarily have the risks or early toxicity associated with a CAR T cell. So those kinds of discussions now are beginning to dominate what we talk about with patients in the context of early relapsed myeloma. At the same time, we also know that there's likely emerging data on teclistamab alone as a single agent in patients who are DARA exposed or DARA resistant. And I suspect that data will also look very encouraging. So whether you partner a BCMA bispecific with perhaps a CD38 antibody or give it alone, again, I think the idea of moving immune therapy earlier and earlier in the treatment paradigm is continuing to emerge. What we also know is that in the coming months, we will likely see data on mezigdomide as well as iberdomide as partners with immune therapy. And again, this is a slightly different approach. Again, the cell mods are separate from the previous IMiD class of agents in that they have more potency, they are more effective partners for immune therapy, and they seem to have a better adverse event profile compared to the previous IMiD classification of agents. And in that context, combinations with either proteasome inhibitors or anti-CD38 antibodies are likely to be the data that we're going to see in the near future and will hopefully lead eventually to FDA approvals of those agents, iberdomide and mezigdomide. But I think ultimately their partnership with agents like bispecifics as well as CAR T cells is going to be where the field is going to move in the near future. Finally, we know that these agents like bispecifics and CAR Ts are moving into frontline therapy. And so how are we going to sequence agents and combinations? How are we going to talk about maintenance therapy? What is going to be the role of high-dose therapy and autotransplant? And what is the role of our current quadruplet-based induction? Those are all going to be questions we're going to be asking in the near future as we begin to incorporate bispecifics and CAR T cells into frontline therapy. And so as you can see, the world of emerging therapies for patients with multiple myeloma is rapidly changing. These changes will likely lead to radical restructuring of what induction therapy looks like, of what consolidation therapy looks like, and what maintenance therapy looks like. And I can tell you from the International Myeloma Society Cure Symposium from just a few weeks ago, the old idea of continuous therapy is going to start to fall out of favor, and we're going to hopefully begin to talk about percentages of patients that are cured with many of these novel immune approaches. So very exciting times. Please stay tuned to this site and others to see updates and that new data. Thank you.